Hello, this is Dr. Behnam. I'm a board-certified dermatologist, laser and skin cancer specialist in the beautiful Santa Monica, California. Welcome to one of our educational videos. The topic of today is poison oak and poison ivy. A lot of patients, when they brush against poison oak or poison ivy, they break out with this allergic reaction. Poison oak are the trees that are typically on the west coast of the United States, and poison ivy are on the east coast, on the eastern part of the United States. When you brush up against them, the clinical presentation is that the areas are going to form blisters, vesicles, and they're very itchy. Patients typically get them around the eyes that could become very puffy. Typically, basically along the arms and forearms are very common because these are the areas where people brush against the trees. But brushing against them, they leave the oil on the skin. And the oil, you could actually transfer it from one area of the body to another area on the body, like the face, unless you wash the area off really well and get rid of the oil. Again, the areas are intensely itchy, and one of the clinical characteristics is that there are linear lines. So when you see linear lines, blistery, itchy, those are classic characteristics of poison oak or poison ivy. I've even seen cases where, unfortunately, some of the oil has gotten on the car seat, and other patients have sat there and basically they gotten the poison transferred basically onto their skin as well. So what is the treatment? The treatment is you have to go on oral steroids. Being on a steroid for 1 week, it's not going to do it. It has to be a 3-week course, typically from 40 to 60 milligrams, and that's tapered over basically 3 weeks period. Also, topical steroids will help a lot to reduce the itch as well. Antihistamines as well as anti-itch medications are also very helpful as well. One of the most important things is to wash the areas right away in order basically to get the oil off of you. Routine follow-up with your dermatologist is very important. Unfortunately, sometimes they could leave scarring, especially in darker skin individuals. In those cases, a bleaching cream might be necessary several weeks or months down the line, basically in order to get rid of the scar. Again, this is Dr. Behnam, board-certified dermatologist from Dermatology and Hair Restoration Specialist. Please visit our website, santamonicaskin.com, for other educational videos, or call us up at 310-315-4989 if you have any questions. Have a nice day.